The Don and Elizabeth Hillman lecture by Dr. Mickey Chopra, Chief of Health at Unicef, again focused on equity. He revealed data on the progress made in maternal and child health as a result of funding to meet the Millennium Development Goals.
And we identified 24 countries which had reduced child mortality by at least 10% over that period of time. Out of those 24 countries, though, 16 had actually dramatically increased inequalities within those countries between the wealthiest and the poorest. So in other words, and at 12 of those 16, actually there's been an increase of more than 10% between the richest and the poorest. The challenge is focusing in on this issue, that we have the interventions, we have the ideas of how to package them and put them together and integrate them. And now the challenge is, how do we start to look at these areas where we're just having the bottlenecks and not giving the coverage up to where we want it to be. There has been some modeling work, and we are working with partners to start to look at and coming up with focusing on some of the interventions which, especially in the very poorest setting, can have the biggest impact. Here's one example of where, our analysis with others in the African science academies showing that contraception and focusing on contraception would be having the biggest impact in places like northern Nigeria in terms of saving maternal lives in the future. And so the focus on skilled delivery is very important, but we mustn't forget that in many settings, contraceptive coverage rates are below 10%. We're now working much more systematically looking at child health days. You may remember these are campaigns that we do once or twice a year to try and get immunization coverage up, and it's been found to be very effective at reaching the poorest populations in particular. So we're now asking the question of how can we integrate other types of interventions, for example, giving out bed nets, giving out deworming interventions, micronutrient interventions. So here we have a vehicle and a means of reaching the poorest. So let's not just use it for measles or for polio, but how can we package a whole lot of other cost-effective and very effective interventions into the same way? So I'm very optimistic. I feel that this is a time when we have the attention of policymakers, we have the attention of political leaders. The onus is very much on us as activists, as people who care, to actually work with counterparts and colleagues in Africa, in Asia. We have made progress, we have success, we have something to shout about and to sell. And I hope now together we can jointly start to develop a common vision which in particular I hope will focus on the poorest, will focus on communities and populations which have become, where mortality and maldevelopment, if you like, is becoming even more concentrated, and we can start to make progress not just in the averages, but also for the poorest and the most vulnerable